Hello all, my name is Hannah Campbell, and today we'll be discussing LGBTQ plus health for college students. I did want to share a potential content warning. There will be brief mentions of suicide and LGBTQ plus discrimination. Unfortunately, members of the LGBTQ plus community often face worse health outcomes. A few examples are a greater likelihood of substance use disorder, higher rates of smoking and alcohol use among LGBTQ plus youth, high rates of suicidal thoughts and suicide attempts, and compared to heterosexual women, lesbians are less likely to receive important preventative care like cervical or breast cancer screenings. A 2010 report by the CDC identified that members of the LGBTQ plus community face some higher rates of intimate partner violence as well. I think it is important to highlight these things to show how sexual orientation and gender identity can impact the 8 dimensions of wellness. The 8 dimensions of wellness, shown in this graphic, are social, emotional, mental, physical, intellectual, occupational, financial, and spiritual well-being. It is important for each of us to try to find our own balance within these dimensions of wellness. Knowing many aspects of our identity can affect our overall wellness highlights the importance for all people to share their gender identity and sexual orientation with their healthcare provider. Being open and honest about your gender identity and sexual orientation allows your healthcare provider to better serve you. This information will remain confidential and ensures that you are provided with individualized care and referrals to other providers who are welcoming to LGBTQ plus individuals, and that you are provided with comprehensive care that spans across the 8 dimensions of wellness. Sharing this information can feel intimidating. Some suggestions are looking at directories, such as the one created by the Health Professionals Advancing LGBT Equality, also known with the acronym GLMA, to find a healthcare provider who is accepting of LGBTQ plus individuals, and bringing up this information at a time that you feel comfortable. It can also help to bring a trusted friend to your healthcare appointment to prepare a list of questions you have for your provider ahead of time. I will share some options for potential providers. The first one is Health Services of Boise State, which is located on the 2nd floor of the Norco building. The Norco building is shown on the screenshot on the right. They offer medical services including STI and STD testing, wellness checks, and counseling services for individuals, couples, and/or groups. Free condoms are also available. There are also great community resources. There's Family Medicine Residency of Idaho. They offer primary care, HIV services, and gender-affirming care. Sliding scale discounts and payment plans are available. There's also ALPHA, which stands for Allies Linked for the Prevention of HIV and AIDS. They offer free hepatitis B and C, HIV, and other STD screenings, as well as free condoms. Additionally, I've provided some other resources that all support balance in the 8 dimensions of wellness. A resource for social and emotional health is the Gender Equity Center. The Gender Equity Center is located on the 2nd floor of the Student Union building at Boise State. They offer brief, no-cost, confidential support services. These services are available to students affected by identity-related harassment, sexual assault, unhealthy relationships, and any personal hardship. The Gender Equity Center website also has a list of campus and community resources for the LGBTQ plus community, as well as information for allies. Some financial resources available to help support your health are the Stephen Nilsson Memorial Fund. This is for LGBTQ plus students who have faced financial hardship as a result of coming out. They offer grants up to $1,500 awarded over the course of 2 consecutive semesters. The Dean of Students Office also offers emergency funds up to $400 for students who are at risk of withdrawing due to unforeseen circumstances. These do not have to be paid back, and students can receive them once during their time at Boise State. While it's important to do what you can for your own health, it's also important to note what may be outside of your direct control. Individual behaviors certainly have an impact, but some of the key drivers of the health outcomes I discussed earlier are the social, political, and physical environments and the people around us, which this graphic helps to depict. Healthy People 2020 highlights some of the barriers to health that LGBTQ plus people may face. These include legal discrimination and access to health insurance, employment, housing, marriage, adoption, and retirement, lack of laws protecting against bullying in schools, a lack of social programs targeted to or appropriate for LGBT individuals, a shortage of healthcare providers who are knowledgeable and competent in LGBT health, and access to safe schools, neighborhoods, and housing. The environments around us matter. Discrimination, prejudice, and a lack of resources are all associated with poor mental health outcomes. However, self-acceptance, peer and family support, and an affirmative community can all protect our health. This has specific implications to the college environment as well. One study that analyzed responses from 2,325 trans college students found that a lack of access to bathrooms and gender-appropriate housing, as well as interpersonal victimization, were associated with lifetime suicide attempts. This demonstrates just how important it is to create welcoming environments, both on an individual and systemic level. On an individual level, it's important to believe that all people, regardless of gender identity and sexual orientation, should be treated with dignity and respect, and then to act accordingly. This includes respecting pronouns, names, and experiences, and avoiding microaggressions. The Trevor Project, a nonprofit dedicated to crisis intervention and suicide prevention for LGBTQ+ youth, explains that microaggressions are everyday comments and questions that can be hurtful or stigmatizing to marginalized people and groups. Microaggressions are subtle, and the person committing the microaggression may have no idea their comments are harmful. An example they provide is the comment, "You don't even look trans," which, even if said as a positive thing, can imply that being perceived as trans is negative. As we learn, we may make a mistake, and that's okay. If you notice you made a mistake, it's important to apologize. If someone points out you made a mistake, the Trevor Project provides the guidance of listening, being accountable, and making a commitment to do better next time. On the systemic level, we should work to create welcoming spaces and policies. These have direct impacts to the health and academic success of LGBTQ+ individuals, and we can all work to create and advocate for these spaces. Lambda Legal has an excellent resource detailing best practices for creating inclusive college campuses, specifically for transgender students, including policies for non-discrimination, housing, and restroom access. There's also a section to understand your own legal rights as a student. On the left is a screenshot taken directly from the Lambda Legal website to give a sense of the resources they provide. Another resource for legal assistance is right here on campus. Boise State University offers free legal assistance for full fee-paying students. Potential topics that can be addressed are landlord and tenant problems and name changes, and more information can be found on the Dean of Students Office website. With these things in mind, we can all work to improve the health and well-being of LGBTQ+ individuals. These are the references I used, and thank you for your time.